Hi, I'm Dr. Vybhav, consultant pulmonologist. Today I'll be talking about tuberculosis. I'll be giving a brief introduction of what tuberculosis is, and I'll be giving you an overview of how to tackle the disease and how to prevent it as well. So tuberculosis is a respiratory condition. It can affect all other organs in the body as well, but mainly affects the lungs. So it is caused by bacteria called Mycobacterium tuberculosis. So in the lungs, if tuberculosis is affecting the lungs, it can spread through droplet infection, that is in the way of coughing, sneezing, or when the saliva or the sputum is spread from one person to another. So, talking about the statistics about tuberculosis, about 40% of the population in India are exposed to the bacteria. So, when I say they're exposed to the bacteria, it doesn't essentially mean that they are infected by the disease. So, these are two different things which we need to know right now. So, I'll be telling you what that actually means. So, everybody who's exposed to the bacteria are not infected. So, the infection occurs mostly in immunocompromised people. So maybe the percentage what I told, 40% is only the percentage which is exposed, but not all of them are infected. So looking at another statistics which I got from the WHO from 2021, so there have been around 1.6 million deaths around the world in 2021 because of tuberculosis. But looking at the brighter side, there have also been 76 million cases who have cured of the disease by taking the correct treatment. So which means that tuberculosis is a curable condition, it's also a preventable condition when intervened at the right time. And there are some countries like India in which there is a vaccination also given against tuberculosis, which is called the BCG vaccine. Most of you might be aware of it. So now let's briefly look at the symptoms of tuberculosis. So when I am talking about the symptoms, I am mainly covering the respiratory or the lung part of tuberculosis. So these are the symptoms which you would have if your respiratory system or your lungs are involved in tuberculosis. So it can be cough which is chronic or lasting for more than 2 weeks. This cough can be associated with sputum production, or it can also be associated with hemoptysis. So hemoptysis is nothing but coughing out of blood. The other symptoms are fever, shortness of breath, chest pain, fatigue, loss of weight. So these are the symptoms which can be present in a case of pulmonary tuberculosis. So like I mentioned earlier, tuberculosis usually affect the lungs, but it can also affect other parts of the body like the brain, the liver, the stomach, the bones, skin, and the lymph nodes, and various other organs of the body. So now I'll just briefly tell you about how one could prevent the disease. So prevention of the disease mainly can be attributed to maintaining good social and environmental hygiene, prevent overcrowding, prevent alcohol and tobacco use. And if you're exposed to the disease, or if you're living with a person who's infected with the disease, get yourself regularly screened and get yourself treated. Now I tell you briefly about some diagnostic methods of tuberculosis. So the diagnosis of the disease nowadays is by one particular test called the Gene Expert, which is a rapid molecular test, which is usually done to identify the bacteria or the bacilli. So this can be in the sputum, or some samples can be taken from the lung, which is called the bronchoalveolar lavage as well. So in children, the diagnosis of the condition can be a little difficult because it might be a little difficult to get the samples, and the symptoms might be masked from other conditions as well. So the treatment of the disease involves mainly by medications. So the medications usually range for a minimum period of 6 months, which can be extended. So they include around 4 to 5 drugs. So again, the treatment of tuberculosis is based on, there is another category of tuberculosis called the drug-resistant tuberculosis, if it's drug resistant or drug sensitive. So based on that, the treatment of tuberculosis is further classified. Now a brief note on people who are at risk of developing the disease. So like I mentioned previously, the main ones who are at risk are the ones who are exposed for a long time to the other people who are having the disease, the people who have HIV infection, chronic smokers or alcoholics, people living in unhygienic and crowded places, and people on immunosuppressive drugs like for chemotherapy, etc. People who have uncontrolled diabetes. So these are the people who are at risk of developing the disease. A brief note on tuberculosis and COVID. Since COVID has been in the limelight for the past few years now, so even though COVID has taken many lives, so tuberculosis in our country especially still continues to be the number one death-causing infectious disease. So So now, because COVID symptoms can be quite similar to that of tuberculosis. It can present with cough, it can present with chest pain or breathing difficulty. So my suggestion to you would be, if you have any of the symptoms, please go and get yourself checked and get yourself treated at the right time, because both the conditions can be treatable. Thank you.